College of Engineering and Technology. I am Pakistalvi, Assistant Professor, Department of Physics, Rogini College of Engineering and Technology. In this video lecture, I am going to explain radiation carcinogenesis. Radiation carcinogenesis refers to the process by which exposure to ionizing radiation leads to the development of cancer. Ionizing radiation, which includes X rays, gamma rays, and particles like alpha and beta particles, has enough energy to remove tightly bound electrons from atoms, creating ions. This can cause direct damage to DNA or generate reactive oxygen species that indirectly damage cellular components. Mechanism of radiation carcinogenesis. DNA damage. Direct damage. Ionizing radiation can break DNA strand, leading to mutation if not properly repaired. Indirect damage. Radiation interact with water molecules in cells to produce ROS, which then damage DNA, protein, and lipids. Chromosomal aberrations. Radiation can cause chromosomal translocations, deletions, and duplications, potentially activating oncogenes or inactivating tumor suppressor genes. Genomic instability. Radiation can induce persistent changes in the genome, leading to increased mutation rates in subsequent cell generations. Bystander effect. Cells not directly hit radiation may still exhibit damage due to signals from nearby irradiated cells. Microenvironmental changes. Radiation may alter the tissue microenvironment, promoting inflammations which can support tumors development and progression. Factor influencing radiation carcinogenesis. Type and energy of radiation. High LET radiation cause more complex DNA damage than low LET radiation. Example, X-ray. Dose and dose rate. Higher doses and faster delivery increase risk. However, even low doses over time can pose a risk. Tissue sensitivity. Some tissues, like bone marrow and thyroid, are more sensitive to radiation induced carcinogenesis. Age and gender. Younger individuals are generally more sensitive, and some cancers show gender specific sensitivity. Genetic susceptibility. Variation in DNA repair genes can affect individual susceptibility to radiation induced cancer. Examples of radiation carcinogenesis in history. Hiroshima and Nagasaki surveyors. Increased rate of leukemia and solid tumors observed among atomic bomb surveyors. Chernobyl disaster. Surge in thyroid cancers, particularly in children exposed to radioactive iodine. Medical radiation. Increased cancer risk linked to high doses of diagnostic imaging and radiation therapy. Radon exposure in minors. Elevated lung cancer risk in minors exposed to radon gas. Prevention and risk mitigation. Radiation protection standards. Using shielding, minimizing exposure time, and maximizing distance from radiation sources. Monitoring and regulations. Occupational exposure limits and public health guidelines for environmental radiation. Medical imaging justification. Ensuring medical imaging is only used when necessary and using the lowest effective doses. Thank you.